Hello, my name is Julie Marshman and I'm the Chief Nurse at Great Western Hospital's NHS Foundation Trust. This year really has been like no other. I've seen firsthand the efforts that our staff have gone to look after every patient admitted with COVID-19, as well as continuing treatment for so many other patients. I also know how much the local community has sacrificed to protect one another. So many of you have stayed inside, limited your contact with family and friends, and have followed important government guidelines to reduce the spread of infection. This has been really important for the NHS, particularly here in Swindon, because you have helped us to keep our admission rates at a manageable level without overwhelming our services. This means we've been able to provide care to every patient who needed it. You have all given up a lot this year. But we don't want your efforts to be wasted. All of us need to continue doing what we can to limit the spread of virus across our community, to protect our vulnerable loved ones, and to ensure our NHS staff have the capacity and resources they need to look after every patient. We don't want infection rates to creep up, and it's important that everybody plays their part in stopping this happen. This means continuing with social distancing, following the rule of 6, regularly washing your hands and wearing a mask in public spaces. When visiting Great Western Hospital, you must follow the one-way system in place. Use the relevant entrances for either staff or public-only use. Wear a face mask in all areas and keep 2 meters apart from others. If you're booked in for an outpatient appointment and you're showing symptoms of COVID-19, please isolate and book a test. You must also let the department know so we can book you in for another time. If you cannot attend an appointment for another reason, please let us know so we can give your appointment to somebody else. Our staff have a really important role to play here too. I ask those who work in the Trust, ensure you are maintaining social distance in public spaces around the hospital, including on breaks and in rest areas. Whilst we understand that it's not always easy to social distance in some clinical areas, you are provided with full PPE to ensure you're kept safe at all times. This is essential whenever and wherever possible. Masks also protect us from ourselves, as adults can touch their faces up to 23 times an hour, with the mouth and nose being the most common areas. It's of course important to make sure we put on and take off PPE in the right way and to stick to strict hand hygiene, particularly when entering and leaving different clinical areas. We will only beat this virus if everybody works together. It is often the simplest things that best protect and prevent the spread of infection, so please continue to follow the guidelines. Remember, if you ever need us, our doors are open 24 hours a day.